Hello, welcome to this new tutorial of the SchrDbb on T waves and U waves. So you need to know that for the T waves and the U waves, we start with the one which is physiologic, that is the T waves. You have to point out the fact that for the T waves, you have to know that for the T waves, you have to tell first the morphology of the T waves. Now, for the morphology of the T waves, you have to point out the fact that the T wave should be erect. Generally, the T wave is erect and it is not much more than one big square. So it's not greater than one big square and it is erect. Is it clear? It is erect and it is not more than one big square. Now, the duration of the T wave is not very important because you have already considered that in the QT interval. Is it clear? So the duration is not very important. Now, we have also the next point of the T wave that is important. That's the inversion of the T wave. Is it clear? So let's say that you have a P wave, then you have the QRS complex, then you have a T wave that is inverted. Now, inversion of the P wave, of the T wave, is actually is classified into two. You have inversion with SC segment elevation and we have inversion without SC segment elevation. Is it clear? You have to know that there are different pathologies with the inversion of the T wave. Is it clear? Now, if you have an inversion of the T wave without without SC segment elevation, it means that there is an ischemia. Is it clear? There is an ischemia, but not a myocardial infarction. But if you have an SC segment elevation, an inversion of the T wave, it means that it is a STEMI, a myocardial, a SC segment elevated myocardial infarction. And that SC segment elevated myocardial infarction corresponds to a transmural occlusion of blood, a blood occlusion that affects all through the wall of the heart. It means that it is all the heart walls that are infarcted in the case of a STEMI, a segment elevated myocardial infarction. Now, when you have an inverted T wave plus no segment elevation, it means that it is just an ischemia, or it can be a myocardial infarction in case of a non-STEMI, non-SC segment elevated myocardial infarction. And now, this non-SC segment elevated myocardial infarction, it is less severe than the SC segment elevated myocardial infarction, where in non-SC segment elevated myocardial infarction is only part of the myocardium that is affected. Either the endocardium that is affected, that is ischemic, or it is the myocardium that is ischemic, or it is the pericardium that is ischemic, and not all. Is it clear? So that is for the non-STEMI. Similarly, with the T waves, you have to understand what are the cure waves. Is it clear? Now, cure waves are also associated with the T waves, particularly when you had a previous ischemia. Now, generally, you have to know that when you have your P wave, you have your QRS complex. Generally, cure waves are slurred as such, and then you have your QRS complex as such. You have an increase in distance. These cure waves correspond to a half big square. Is it clear? This cure wave distance duration correspond to half big square, and similarly their amplitude correspond to half big square. Is it clear? So that is a cure wave. When you see this, it is a pathologic cure wave. Is it clear? And a pathologic cure waves correspond to a previous ischemia. Is it clear? In a case where you see an SC segment depression, it also corresponds to ischemia. Is it clear? So those are the different things that you have to visualize for the SC segment and the T wave inversion. Lastly, you have what is called, if you have the T wave that is very enlarged, is it clear? If you have a T wave that is very enlarged, more than one big square, that is called a tall peak T wave. Is it clear? And that tall peak T wave generally occur in hyperkalemia. So in hyperkalemia, you're going to have what is called tall peak T waves. So those are the different elements that you have to visualize here. The next point of this tutorial is going to be the U waves. Is it clear? Generally, when you have your P wave, your QRS complex, then you have your T wave. Some patients have U waves at the end. Is it clear? U waves may be found in old patients or in children at the extreme age. Is it clear? They may be found in all patients and in children. And if you're an adult, a normal adult, generally you always correspond to an electrolyte imbalance. Is it clear? Particularly a hypokalemia or a hyperkalemia. So generally they are electrolyte imbalance that are associated with U waves, and they are very pathologic, particularly if you are in the intermediary ages. Is it clear? And for you to visualize the U wave pathology, it is best to visualize the other element of the ECG. Is it clear? So those are the different things that you have to visualize on a physiologic ECG interpretation. Now, the last element of the physiologic ECG interpretation is your summary or your conclusion. Is it clear? In order for you to conclude, what you have to do is that you write all the major elements of your ECG interpretation, all the major elements of your ECG interpretation on your paper, and then you conclude with a pathology of the ECG. Is it clear? So those are the different elements that you have to understand when you're doing a physiologic ECG interpretation. So from here we now move up to the next point, that is a pathologic ECG interpretation. Thank you.